yourself. So can you paint a day in the life of what that was like for as an elementary child, what that looked like specifically?
Certainly. To be extremely specific, when I was in 7th grade, we were having to read aloud from this playbook. And of course, our speech teacher, who was one of my most favorite teachers in the whole world, she picked who was going to read for the different characters, and I got to be one of the characters. Pretty stoked about that. So it came to one of my lines, and the line was like, "Gee whiz, Wally," or something like that. And so I start reading, and I say, "Gee whiz." My teacher bent over laughing. She was cracking up. It was the funniest thing she had ever heard. Totally okay, I just didn't know why she was laughing. So I took that little time and I stuck it way back here, remembered how it happened, wasn't sure what was so funny, but I thought someday I'm going to understand why she laughed so hard. And it was because I was having a confusion between the hard and soft G sound, the J sound and the G sound. J and G were totally interchangeable for me. I could say, if my mom wouldn't have been named Jean, I would have called her Geen. Not had any issue with that. I think it's kind of an endless confusion. When I see these kids, they just look like their world is swirling around them, and they have a really hard time really connecting. I remember having extreme anxiety about being on the phone, just because I had nothing else to connect with, and so that's really difficult, especially because a phone is an auditory only kind of situation. Go Skype. No, just kidding. But I think that it's really important to draw a distinction between intelligence and processing ability, because a lot of these kids, if they're able to still stay up with all of their, typically developing peers, they have to be beyond intelligent in order to just keep up. Because I was working with a 6-year-old once, and we do this little game where we break words down into sounds. You guys know what I'm talking about. Where we break words down into sounds called phonemic analysis. And I said to her, because we were pretty far along, I said, okay, what is a word that starts with a short I? The I sound. 6 years old, mind you. Igneous. I said, igneous! I learned that in 7th grade, but that's cool. Igneous. I was like, can you use that in a sentence? She kind of looked at me for a minute. She goes, I can't quite use that in a sentence, but I know it's like a type of lava rock, like metamorphic is a type of lava rock. Like, that's ridiculous. Okay, can you break that down? She said, sure. Igneous. It's pretty ridiculous too. So I always I make a word hall of fame sometimes. It's kind of something new I've been trying out. Make a word hall of fame when the kiddo just blows me away, and it's just like one of those moments. And I said, sister, that is going in your word hall of fame. And she looked at me and she goes, what's a hall of flame? Intelligent, with processing difficulties, completely precocious, but I mean, it's amazing to me. So I can't imagine. I mean, I feel like my processing difficulties were probably fairly mild, but it still would have kept me from getting my doctorate. And I never even had direct therapy. I had secondhand therapy. I feel so bad for those first 4 kids that I worked with, because I think they probably taught me more than I taught them. But don't worry, that was a long time ago. So anyway, but I see now that when I'm in background noise, I feel like I'm the stronger communication partner. I start actually trying to understand what other people are saying around me, just to just to see if I can do it. And I've actually heard some really hilarious miscommunications that I'll have to tell you in a different arena. But anyway, pretty hilarious though. You'll just have to leave. All right, guess what? We talked mostly about kiddos. Of course, we actually see kiddos as being adults after they're 12 years of age auditorily. But I've been working a lot with adults and people with hearing loss. Just because somebody doesn't have hearing loss, or just because someone does have hearing loss, does not make them exempt from this category. In fact, it may make it a bigger category. I would like to give some shout outs. Christine Brennan had a lot of really good factoids that I used in this presentation, as well as information from Dr. Sarah King of Midwest Ear Institute and Jack Katz, of course, of Kansas City. Sarah King is a wonderful resource in the area, especially because she can take some insurances and she can work with Medicaid, which is pretty awesome. But she's in Kansas City. And then Jack, of course, is pretty amazing. This presentation was co-sponsored by the International Dyslexia Association of Kansas and Missouri. If you need any information about dyslexia or becoming a part of that branch, let me know. All right, questions? Anybody have any questions? Yeah.
Who besides audiologists can, or if anyone besides audiologists can diagnose an auditory processing disorder?
The only professional that can diagnose is an audiologist. Treatment, screening, that can be anyone else. Because we want to make sure that we're identifying what is a peripheral hearing sensitivity issue. So being able to understand the beeps and how that may affect the auditory processing abilities. Of course, I would go for an audiologist who has interest or expertise in this arena, since it's not something that people deal with generally. But yeah, right at this point, it's just audiologists that do the diagnostic part. I think that, but there are some really good screening things out there, like the auditory skills assessment, that I would highly suggest for people who work with kids 3.5 to 7-year-olds. And it's like a 15-minute test, and it can really,
Who gives that?
who can give that? The screening test, speech pathologists, psychologists, allied health workers. What profession are you in?
I'm wrong.
You're a mom. Awesome. Yeah. That's great.
I'd like to piggyback on that. I respect the audiologist diagnosing it. What though would you recommend when your gut tells you that you think this might be it? There's some different. I've tried to kind of get the line of who to ask and who to go to and sending the kid on, but that can be lengthy and difficult. So I guess my question, and this kind of answers it too, is what's something we can get our hands on and start to work on some strategies? Are we screwing things up more by not having the diagnosis, or is it something that you need for a diagnosis first?
Okay. What we really need for a diagnosis, in order to do the testing, the most basic information that we actually need is the hearing test. And then we're going to want to see a case history to see if this is kind of going along with what we're thinking. So in order to make that process a little shorter, it's hearing test, case history, and then, yes, sadly, it's the diagnostic piece. This isn't answering your question at all. So what you're wanting, we have a checklist called the Buffalo Model Questionnaire, and it can kind of help you get a pretty good idea of what of the likelihood that this is going to be a pretty big deal for the person. And I think that in filling out some of the case history forms, you kind of get an idea whether this is your kiddo or not.